Okay. Thank you. Did a good job.
Okay.
We'll see.
She has one more. She
Got
does.
some steps up here.
I missed it. Senator, if you'd like to move on with file item number 5. This is Senate Bill 999. This is our last bill for this hearing. File item number 2, SB 323 by Senator Hernandez, and file item number 3, SB 622 by Senator Hernandez, have both been pulled by request of the author. If you'd like to proceed on
Yes, thank
Senate
you
Bill
very
999.
much. From guide dogs to contraception. I don't know.
It's been moved by Ms. Baker, seconded by Ms. Eggman. Senator, proceed.
I'll make that brief then with that wonderful bipartisan support already. What this bill does is just providing greater access to birth control simply by changing the timing of the contraception dispensing. Instead of being limited to 1 to 3 months of the supply, with the good judgment of a doctor or the pharmacist in charge, they are authorized to dispense up to 12 months of FDA-approved self-administered contraceptives at one time. It still gives all the authority to the doctor or the pharmacist to make an informed choice on whether that prescription should be 30, 60, 90s, or up to 12 months. Ask for your aye vote.
Thank you, Senator. Let's move to testimony and support.
Good afternoon, Mr. Chairman and members of the committee. My name is Amy Moy with California Family Health Council. CFHC champions and promotes quality sexual and reproductive health care for all. We administer the federal Title X family planning program and support the delivery of high-quality family planning services to over 1 million women, men, and teens each year at over 340 health centers statewide. We are proud to co-sponsor this bill, and we thank Senator Pavley for her leadership on this important measure for women's health. Women across our state with public and private health insurance need and deserve equal and consistent access to birth control. As the Senator noted, the research is very clear. Providing an annual supply of contraceptives is a significant contributor to improving the effectiveness of birth control and save state dollars along the way. That's why SB 99 has drawn broad support from a wide range of health advocacy and provider groups, including the California Medical Association, the California Primary Care Association, the California Association of Physicians Assistants, California Academy of Family Physicians, many more, as well as Kaiser Permanente and the local health plans of California. While SB 99 is a legislative innovation, providing a year's supply of birth control is not new in our state. This best practice in high-quality family planning care has been utilized by our Family Pact program since its inception, and the Department of Healthcare Services has recently also ensured that Medi-Cal managed care plans cover dispensing of a year's supply of birth control at once. While this is great progress with millions of women moving into new coverage options and some choosing other self-administered methods of birth control like the ring and the patch, we can and must do better for the women of California. SB 999 continues California's long history and commitment to breaking down barriers to reproductive health access and advancing policy solutions that help reduce unintended pregnancies and save the state dollars along the way. And for these reasons, we strongly urge your aye vote.
Thank you. Additional testimony and support.
Thank you, Mr. Chairman and committee members. My name is Dr. Mitchell Crennan. I'm currently professor and chief of family planning at the University of California, Davis, in the Department of Obstetrics and Gynecology. Although I'm a physician with UC Davis with expertise in my field for more than 20 years, the testimony expert opinion I provide represent my own personal and professional opinions and don't reflect the official positions of UC Davis Health System or the University of California. Unlike other prescription medications, oral patch and vaginal ring contraceptives have a very time-sensitive nature. If a man or woman misses a day or two of a blood pressure medication or a cholesterol-lowering medication, it's highly unlikely that any medical consequences will occur. However, for a young woman, as you all know, using an oral patch or ring vaginal contraceptive and missing just a few days can result in an unintended pregnancy. And the time-sensitive nature of these medications is what makes this bill so very important. The state of California actually studied providing 12 months of oral contraceptives to women, so we have hard data from studies. The California Family Pack program compared pregnancy rates in women who received a 1-year supply or up to a 1-year supply as compared to 1 or 3 packages at a time back in 2006. The study included more than 84,000 women who received birth controls. The pregnancy rate was reduced by 30% among women getting a 12-month supply as compared to a 1 or 3-month supply. The abortion rate was reduced by nearly 1/2. Assembly members, these type of findings are amazing. This was not a study that made women have a 1 or 3-month supply first. These dramatic outcomes occurred when women were allowed to have up to a 12-month supply. For these women who were seen at clinics at which they could obtain a 1-year supply, only about a third selected 12-month supply, about a third selected 1 or 3 months, and about a third selected somewhere between 3 or 12 months. So women can make these decisions on their own. For this time-sensitive treatment, allowing women to select up to a 12-month supply dramatically changes lives. It decreases unintended pregnancy rates and abortions substantially. As far as safety, providing a 12-month supply is very safe and will not put any patients at increased risk. The CDC does not recommend any follow-up for women who receive a prescription for an oral patch or vaginal ring contraceptive. The CDC selective practice recommendations state that no routine follow-up visit is required other than routine visits. Accordingly, a woman who
Thank
receives...
you for your testimony. I know you will be here for additional questions if members on the
I
dais
appreciate it.
has a bipartisan motion and second,
Which is
if
a
we
good
can
sign.
continue.
Don't mess it up.
If you'd like to conclude.
I appreciate it.
Thank you. Additional testimony and support.
I'm just here to help answer any questions. I'm a legal counsel with Planned Parenthood.
Appreciate that. Thank you. Let's move to additional testimony and support, please.
Tam Ma with Health Access California and strong support.
Thank you.
Gregory Kramer on behalf of Planned Parenthood Affiliates of California. We are a proud sponsor of this bill and strong support.
Thank you.
Allie Fletcher with the ACLU of California and support.
Thank you.
Brian Warren with the California Pharmacists Association. We're officially neutral on the bill, but we've actually been working very closely with the author, her staff, and the sponsors and appreciate their work with us, and we do support the bill proposal.
Thank you.
Good afternoon. Catherine Brandenburg representing Alameda County Board of Supervisors in support.
Thank you.
Aaron Clark and representing California Academy of Physician Assistants in support.
Thank you.
Randy Hicks with the California Secular Coalition in strong support.
Thank you.
Alicia Val, National Association of Social Workers, strong support.
Thank you.
Juan Thomas on behalf of the California Medical Association in support.
Thank you.
Jody Hicks on behalf of the California Academy of Family Physicians in support.
Thank you. Let me ask if there's additional testimony in support. Hearing and seeing none, we ask for testimony in opposition. Please approach. Please proceed.
Hi, Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies. I'd first like to thank the author and sponsor. We have had an open dialogue as this bill moves forward. Unfortunately, today we are here with an opposed unless amended position. The two amendments that we would respectfully request, one is to give discretion to the plan to be allowed to require that a patient initially be stabilized on a drug prior to filling the 12-month prescription. That would look like the plan could limit the first initial fill to 90 days, and then subsequently then you would have the 12-month fill going forward on that medication. The second is a delayed effective date. Reasonably for the purposes of updating our vendor agreements and implementation, given the timing of when a bill is passed and signed into law and then becomes effective that following January, it makes it very difficult for our members to actually implement in a timely manner. And so we respectfully request that we be given a delayed implementation date to do that in a timely manner. Thank you.
Thank you. Additional testimony in opposition.
Jennifer Alley with the California Association of Health Plans. We too have an opposed unless amended position, and I defer my comments to my colleague. Thank you.
Ms. Watkins. Okay. Additional testimony in opposition.
John Winger on behalf of America's Health Insurance Plans would echo the comments of ACLIC.
Thank you. Let me ask at this time if there's additional testimony in opposition. Hearing and seeing none, let me turn it to members on the dais for questions. Ms. Baker.
Thank you. What a pain it is if you're if you or your constituents in the 1 month, the 3 month, whatever it is, and the consequences are significant. I actually think this is a pro-life vote. and I very strongly am grateful that you brought this forward. And I'm sure the administrative part about implementation you can work out, but just wanted to say thank you for bringing it forward. I have a lot of constituents who will be very grateful to you.
Thank you.
Thank you.
Hearing and seeing no additional questions from members on the dais, let me turn it to Senator Pavley to close if you'd like to address some of the concerns
Certainly.
raised.
And I think Assemblymember Baker's comments serve as a really good close because it actually saves money, allows women to choose if and when to have a baby, so you don't have unintended pregnancies. And yes, it is a pro-life thing because it's estimated that there will be 700 fewer abortions each year. This is not a new mandate on the insurance companies. They're already providing it. It's just, is it 30 days, 60 days, 90 days, and it gives the authority to the person's doctor or the pharmacist to go up to 20 days if it's a new person. They may want to restrict it if there's some medical issues or problems in their in review. They will, of course, use their judgment. That's why every medical association is supporting this. They know they can implement this safely. I think it's in the best interest of women, and I ask for your aye vote.
Thank you, and thank you for addressing the safeguards so we make sure that people are safe, and we do still allow that discretion in this measure. So appreciate that, Senator. This is due pass to appropriations. The chair is recommending an aye. And with that, we have a motion by Ms. Baker, a second by Ms. Eggman. Let's go ahead and call the roll.
Salas.
Aye.
Salas, aye. Bro.
No.
Bro, no. Baker.
Aye.
Baker, aye. Bloom. Bloom, aye. Campos. Aye. Campos, aye. Chavez. Chavez, aye. Daly. Dodd. Aye. Dodd, aye. Eggman. Aye. Eggman, aye. Gatto. Gatto, aye. Gomez. Aye. Gomez, aye. Holden. Aye. Holden, aye. Jones. Mullen. Aye. Mullen, aye. Ting. Aye. Ting, aye. Wood. Aye. Wood, aye. 13 to 1.
That measures out 13 to 1. Thank you, Senator. At this time, we're going to go ahead and lift the call on all the measures and determine the final vote counts. We will start at the beginning of the file order. We will begin once again at file item number 1, Senate Bill 66 by Senator Leyva. Madam Secretary, call the absent members.
Bro.
Aye.
Bro, aye. Campos. Aye. Campos, aye. Dodd. Aye. Dodd, aye. Eggman. Aye. Eggman, aye. Gomez. Aye. Gomez, aye. Holden. Aye. Holden, aye. Mullen. Aye. Mullen, aye. Ting. Aye. Ting, aye. 16 to 0.
Okay, that measures out 16 to 0. File item number 2, Senate Bill 323, and file item number 3, Senate Bill 622, have both been pulled. We are now at file item number 4, Senate Bill 778 by Senator Allen. Call the absent members.
Campos. Campos, aye. Dodd. Dodd, aye. Eggman. Aye. Eggman, aye. Gomez. Aye. Gomez, aye. Holden. Aye. Holden, aye. Mullen. Aye. Mullen, aye. Ting. Aye. Ting, aye.
That measures out 14 to 2.
1.
14 to 1. Correction. Let's move to file item number 5, Senate Bill 999. Call the absent members.
Daly. Jones.
Okay, that measures out 13 to 1. Let's move to file item number 6, Senate Bill 1039 by Senator Hill. Call the absent members.
Campos. Aye. Campos, aye. Eggman. Aye. Eggman, aye. Gomez. Aye. Gomez, aye. Holden. Aye. Holden, aye. Mullen. Aye. Mullen, aye. Ting. Aye. Ting, aye. 11 to 5.
That measures out 11 to 5. Let's move to file item number 7, Senate Bill 1046 by Senator Hill. Call the absent members.
Campos. Campos, aye. Eggman. Eggman, aye. Gomez. Gomez, aye. Holden. Holden, aye.
That measures out 16-0. File item number 8, Senate Bill 1174 by Senator McGuire. Call the absent members.
Bro. Bro, aye. Campos. Campos, aye. Eggman. Eggman, aye. Gomez. Gomez, aye. Holden. Holden, aye. Mullen. Mullen, aye. Ting. Ting, aye.
That measures out 16-0. File item number 9, Senate Bill 1192 by Senator Hill. Call the absent members.
Campos. Campos, aye. Eggman. Eggman, aye. Gomez. Gomez, aye. Holden. Holden, aye.
That measures out 12-2. File item number 10, Senate Bill 1193 by Senator Hill. Call the absent members.
Bro. Bro, not voting. Campos. Campos, aye. Eggman. Eggman, aye. Gomez. Gomez, aye. Holden. Holden, aye.
That measures out 13-0. Consent calendar is file item number 11, 12, and 13. Senate Bill 1194, Senate Bill 1196, and Senate Bill 1261. Call the absent members.
Campos. Campos, aye. Eggman. Eggman, aye. Gomez. Gomez, aye. Holden. Holden, aye.
That measures out 16-0. File item number 14, Senate Bill 1331. Call the absent members.
Bro. Bro, aye. Chavez. Chavez, aye. Gomez. Gomez, aye. Jones.
File item 14, Senate Bill 1331.
Jones, aye. Mullen. Mullen, aye. Ting. Ting, aye. 16-0.
That measures out 16-0. I believe a couple of members want to check on their votes, and we will do that and announce the final roll call. Okay, final announcement of vote counts. File item number SB 66, 16-0. File item number 4, Senate Bill 778, 14-1. File item number 5, SB 999, 13-2. File item 6, SB 1039, 11-5. File item number 7, Senate Bill 1046, 16-0. File item number 8, SB 1174, 16-0. File item number 9, SB 1192, 12-2. File item number 10, SB 1193, 13-0. Consent calendar, which is file items 11, 12, 13, Senate Bill 1194, 96, and 1196, and Senate Bill 1261, 16-0. File item 14, Senate Bill 1331, 16-0. Thank you. With that, we will conclude the Committee on Business and Professions.